Welcome to Season 3 of Purposeful Empathy. My name is Anita Nowak, and this show is all about amplifying the voices of people around the globe who believe the world needs more empathy and are doing something about it. This episode was brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. Thanks for watching. Enjoy the show. So welcome to a new episode of Purposeful Empathy. Today I'm joined by Jason Finucan, who is a mental health advocate, stigma fighter, professional speaker, and founder of StigmaZero, a company dedicated to helping organizations manage mental health in the workplace. He's also the instructor of the Create Your StigmaZero Workplace online training program and the author of Jason 1 StigmaZero, in which he offers insight on how we perceive mental illness in our society, the important role that empathy plays, and what we can all do to affect change. Thanks so much for being here, Jason.
My pleasure, Anita. Thank you so much for having me.
So let's start with the backstory. How and why you transitioned from battling your own mental illness to becoming a mental health advocate and, like you say, a StigmaZero fighter, a stigma fighter.
Yeah, so I have to give full credit to a gentleman named Mike Santoro, who was a volunteer for a Montreal-based grassroots organization called AMI Quebec, and they do great work helping people, both caregivers and as they call it, consumers, or the people with illnesses, to learn about their illnesses, learn about how to manage them, and what can be done. I took a mood and thought disorders course because I had just been diagnosed with bipolar disorder and I needed to learn what was this thing I had. And it was I think a 7-week course every Tuesday night. And on one of the weeks, this gentleman came in, and Mike had schizoaffective disorder. And he told his story about how his illness hit him, how it threw him very, very hard for a loop, and then how he finally was able to recover and overcome stigma, start taking treatment, etc. While I listened to him, I had a massive light bulb moment because I realized that in the last 3.5 years I've been fighting my illness, I had not heard from someone who'd actually lived through an illness like this. I'd heard from doctors and nurses, academics, friends, family members, but nobody who'd been there. And there was something resonant about that. It really struck me as, oh my God, this guy has just given me essentially hope, because he's shown me that there is another side to this. You can get past this. And I made the decision on the spot that when I get better, I'm going to come back to AMI Quebec and I'm going to say, I'd like to volunteer and speak and share my story so I can do for others what Mike did for me. That's how it started.
And so would you mind sharing a little bit of your own personal journey?
Absolutely. The short version is, I learned about mental illness through the strangest and most roundabout way possible. I had a heart defect as a young boy and ended up needing open heart surgery at 12 years old. And why that's relevant to mental illness is because that experience came with zero stigma. Not one person in my entire life really judged me, thought that I should have worked harder, thought that I maybe didn't need the heart surgery. I mean, none of those things were said to me. I was rallied around with enormous empathy, and most of it purposeful. And the beautiful part about that was I learned, rather inadvertently, and I didn't know it at the time, but I learned what it's like to have an illness that does not come with stigma. So that later in my life, when I was in my 20s working for McGill University, this is when I met you, Anita, I ended up experiencing the symptoms of a mental illness. I didn't know what it was, but I had massive stigma, self-stigma about the illness. And then I watched others around me have stigma. And it created a different pattern of experience and reaction to the illness. It was very confining. What it did and what it does to a person is it makes you scared to approach the illness in the way you would any other illness. And so you're handcuffed somewhat, which makes the illness kind of grow and get worse rather than you actively trying to treat it. I only figured all this out after I overcame stigma, after my illness reached a point that it was so severe, I actually was hospitalized against my will for 3 weeks in a psychiatric institution because I'd had a manic episode. And when I came out of that hospital, I now had the diagnosis of bipolar 1, and I finally had beaten down stigma. And that's actually the same 3-month period that I met Mike and heard his story. So all those things happened at the same time in 2005. And frankly, my open heart surgery is what helped me nail the coffin of stigma for me, just me personally towards myself. I asked myself the simple question, what would I have done at McGill if my heart problem had come back instead of this new illness of bipolar disorder? Well, of course, I would have openly spoken about it with my managers and colleagues, would have sought medical treatment immediately. I would never have felt shame. I would never have felt fear. I would have just recognized I was ill or had an illness, and I would have dealt with it. But I did none of those things when I had a mental illness. That to me was a glaring societal problem, and it was one that I felt like I could have an impact on. And that's why I became an advocate and continue to this day.
So you mentioned earlier when you were recovering from your heart surgery that there was this outpouring of empathy, purposeful empathy, and there was like an absence of that kind of outpouring of empathy when you got back to work after discovering that you had a mental illness. What would you provide as advice? I mean, you're only one person, so everybody's different, but in general, what are some of the ways in which people can be helpful to somebody coming back to work, or even if it's not the workplace, even if it's like a cousin or a nephew or an uncle? What are some of the things that people can say, or how can they behave that is actually showing empathy?
Absolutely. And I do have an answer that applies to everybody. It really does. And it ties into your work, Anita, because the core ingredient that stigma impedes in this relationship between an individual who's well and an individual who's not well is empathy. If you have a physical illness, there's no impediment to the empathy. People just feel it and they show it and they express it. If you have a mental illness, the stigma, the fear, the lack of understanding impedes the empathy. And so sometimes people, even because they're afraid that they don't want to be stigmatizing of the person, they'll actually go so far backwards in protecting that idea that they won't even show the normal amount of empathy. So I always say to people, if you are unsure how to speak to an individual who you know has a mental illness and you want to help them, simply ask yourself, what would I say if this person had cancer? What would I say if this person had any other illness? What would I say if this person was hit by a car? Because frankly, that's what it's like when you are cruising along in your life and you're healthy, and then suddenly your brain hijacks you and throws you into either depression or anxiety or any other symptom of a mental illness. You feel like you have been hit by something really big, and all you're looking for is non-judgmental empathy. I mean, as we know, real empathy does not have judgment in it. And so that's what you need to do, is simply communicate to that person that you may not fully understand what they're going through, but you empathize and you care for them and you are there to help them. And engaging in a conversation where you simply say, listen, I don't want to make you talk about anything you don't want to talk about, but I want you to know that I am here for you. I recognize what you're going through is a difficult thing, and please let me know if I can help you. I can tell you right now, the vast majority of individuals experiencing the symptoms of a mental illness would welcome that kind of a sentence, that kind of a sentiment, because they don't get it enough. It's happening more and more now. More people are more comfortable speaking now, but it's still not even close to equal with how we would act with physical illnesses. And some people get stuck with the verbiage, like, what do I exactly say? And I've used this analogy. I've said, listen, if you had a friend who, let's use a female, for example, she just was diagnosed with breast cancer and she just had a double mastectomy, and you're going to visit her in the hospital. Is that the easiest social situation to be in? Not necessarily, because you're not sure what to say. You're not sure how that person's feeling, but you figure it out. You go and you say, how are you? You go and you say, if it's the first time you've seen them, you give them that empathy about their experience and what they've gone through. You say, I am terribly sorry that you're going through this, but I just want you to know that you're going to make it, you're going to be fine, and I'm going to help if I can. That's all people want to know. They don't really need you to do as much as you think. They just want to know you're in their corner and you're not judging them. And so eradicate judgment and increase empathy. That applies to anyone.
So let's take this to the workplace, because you saw what it was like to live through this lack of empathy as you come back from a mental illness, like what's the word, when somebody gives you a label, to like a name to it?
Diagnosis.
Diagnosis, yeah. And you know, that touched you, that moved you, that stayed with you. And a couple of years later, you decided, I think there's actually something systemic that we could do at an organizational level that would help reduce the stigma in the workplace and make it easier for people to come back to work if they've had a mental illness, right? So tell us a little bit about StigmaZero and what you do.
Thank you. Yeah, sure. So I spent many years, from 2005 to 2015, I continued being a volunteer advocate, just doing keynotes and sharing my story and doing that work, but purely as a volunteer. In 2015, I decided to actually form the company that I now run, called StigmaZero. And what we do is we help any workplace or educational institution who wishes to improve their understanding of mental illness, their understanding of mental health, and improve their response to mental illness in that workplace or school. And the idea is that there are lessons that can be learned through training that will improve how a workplace or an organization responds to this sort of thing. Because what's happening is most managers care equally about all their employees, but if one of their employees, to use the breast cancer example, if one of their employees is diagnosed with breast cancer, that manager is going to have a very high degree of empathy. They're going to work with that person to deal with their leave, their return. Maybe they went through chemotherapy. Maybe they needed to adjust their work schedule during their chemotherapy. All of it will be on the table. It will be totally lacking of any stigma. It will be collaborative, and the person will not be judged as though their illness is their fault. Mm-hmm. Unfortunately, with mental illnesses, it doesn't happen as cleanly that way. Often what happens is a person's behavior is noted. So perhaps that person's now depressed, or in my case, I was also hypomanic. So I was acting a little bit differently than normal. And that was noticed, but it wasn't understood as a mental illness. And frankly, I wasn't disclosing it because I was afraid of how things would be perceived and how I would be perceived as a professional. We don't think of those things when we have a cancer. We don't think of how we're going to be perceived as a professional. We should never have to think that way about mental illness. So the training that I provide is partly mental health and mental illness awareness. And then we actually spend quite a bit of time developing empathy and emotional intelligence, because those are the two most important tools in anyone's toolkit if they want to have a meaningful conversation at work with respect to this. Because you do need to respect personal boundaries, but there is a way to approach the problem as a human and treat the person as a person with an illness rather than a character problem or a work ethic problem. And so that is the differentiation that we're trying to achieve. The end goal is for organizations to have the exact same response to illness, regardless of what kind of illness. Mm-hmm. So if the person who goes off on a leave with cancer gets a get well card and flowers sent to their home or hospital, if when they return to work, they're welcomed like they're returning from battle as they should be, all of those procedures can be written into policy so that when somebody goes off on a medical leave due to any other illness, including a mental illness, they get the same treatment. As it stands right now, they often do not.
Right. So do you have any stories from clients that you've worked with where, you know, you can celebrate a win on the training having its meeting its goals?
I do. Actually, I have a recent one that is very exciting to me. So there is this wonderful company. I can say who they are because they're one of their testimonials is on our website. But MIQ, they're a software company, and in the States and in Canada, one of their senior managers who took the program sent me an email directly and copied the global head of HR who I had been dealing with to get the program into the company. And basically to say, I just finished your program. And it was the best professional development work I've ever done. It has immediately helped me to understand what I need to do as a manager when one of my team members has a mental illness, because they actually have that situation occurring right now. And the manager said, you helped me to identify, your program helped me to identify I was doing the following several things wrong. I was not talking with the person in the same way I would with a physical illness. And I did have some stigma inside of me that I didn't know was there, and et cetera, et cetera. And then he said at the end of it, I have now spoken with this individual and we are working on a work plan to make their experience as they are recovering better. And basically this person was like, I think everybody needs this training. I think every manager of a person in any company anywhere needs this kind of training. So that was exciting. That was very rewarding to hear that.
Yeah, and so preparing for this interview, I was thinking, you do this important training within organizations, and lately the training that's been happening, that's on a super big uptick for a lot of appropriate reasons, and as it should be, is this like EDI training, right? Equity, diversity, inclusion. A friend of mine actually calls it JEDI because she adds the justice in front of it. So I was thinking like JEDI mental health wellness, like if only that spelled a cool word, because I actually feel like all of that is about debunking our own implicit biases that we have so that we can see each other as full human beings and take away the systemic biases that exist in our workplaces and our society. I think it's so important what you're talking about.
And it's interesting you make that connection. I use the analogy to racism frequently to get people to understand what stigma really is, because I think some people confuse stigma as an active thing. It's actually a passive thing. Stigma is something you have in your mind. It's a perception. When you act on it, it becomes discrimination. So when you can think of racial profiling, that is racial discrimination. But having racist thoughts, that's more like stigma. It's inside you, it is more latent, and it is something where you look at a person and you almost immediately, upon receiving a bit of information about them, like the color of their skin or the look of their hair, or that they're someone who has a mental illness, you receive this one little bit of information and you classify them as different from you, as other, and that's the fundamental element that creates this problem with racism and inequality. It is exactly the same human error that is happening with mental illness. You're applying a stigma towards a person for something that they not only cannot control, but you're assuming that that attribute is their identity. Right. And it's not. I think any person, of course, a person of color would say that that has a massive aspect of their identity, but it is not their only identity. And so my bipolar disorder is a part of my identity, but it is not who I am alone. And so that's what we're really looking for, as you said, to see each other as full human beings without any biases. That is where we're trying to get to. And for sure, this kind of training, I would put the EDI training on exactly equal footing with the mental health training as something our society needs to keep doing as we move forward if we want to get ahead in this and solve this social problem.
So I think, 2 years ago, organizations should have been calling you to book your training, but then COVID hit. And, there's chemical mental illness, and then there's also situational mental health issues, chronic overwhelm and stress. You don't have the same support systems because you're not spending time with family and friends. There's a shit ton of stuff that has happened to us on a mental health level that managers really need to pay attention to now, given COVID, right? So what advice and what are you seeing in that space?
There is a very interesting side effect, and that's what it is. It's a side effect to the COVID pandemic, is that is positive in a way, is that more and more individuals and workplaces are awakening to the need to address the problem of how we see mental health, how we respond to mental illness, how we talk about it, how we don't talk about it, all of that. So I would say 4 years ago, it was a little bit like screaming into a void. doing this work because very few people were fully recognizing it. What I got a lot of was, that sounds really good, but no thanks. There was really a lot of that going on. Now we're getting much more responsiveness when we reach out to potential clients, but we are also receiving way more inquiries because companies are realizing, oh my God, we need to deal with mental health. It's just bubbled to the surface. Now I don't love the fact that it took a global pandemic to get this to happen, but the truth is that society, humankind overall, will be in a better place by placing this as a priority. And we've been saying for years, I actually co-authored an academic white paper to try to prove that there is an ROI to ending stigma in the workplace, an actual bottom line return on investment. And the way that it happens is very simple. Currently, when you have an illness, you go and get it figured out. But when you have a mental illness, you often deny it, delay it, hide it, try to work through it. During that period, you are working at a level below your optimum, but you're going to work. And that's called presenteeism. It is a hidden cost of mental illness, but it is a massive one. It's in fact the largest economic impact of mental illness is presenteeism, not absenteeism. People think it's all about all the times that people have to leave work. That is not the biggest drain.
I imagine, like, if you're going through a divorce or if you lost a member of your family, that's kind of the same idea. And here you go. Yes. Oh, so fascinating. Never heard that term before. Yeah.
Yep. So that is what we're really trying to address, because clearly no one has the cure to mental illness. It's just like cancer. We're not going to stop it from happening. But what we can do is we can improve the way we respond. So go back to my scenario. I spent 2.5 years as a walking presenteeism statistic trying to work through my illness, fixing it on my own because of stigma. If you go back and erase stigma, well, then I behave the way I would have if my heart problem had come back. I seek medical attention almost right away. I tell my manager, I'm experiencing this thing. I'm seeking medical attention. I may need some time off. And I deal with it sooner, which allows me to either avoid a leave, or if I need a leave, it's a shorter leave. And I return and get back to full steam faster. And when there's no stigma in an entire workplace, imagine that happening all around. So the level of morale, the level of workplace cohesion and culture is going to go up, because people are going to feel good watching others, even if you never have a mental illness, just watching others be treated respectfully makes you less afraid of, geez, what happens if I have one? I had people at McGill actually tell me that. They said, watching how you were treated with your mental illness made me afraid of what happens if I were to experience a mental illness. And that's not a healthy way to run a workplace. So this is what we're trying to address.
And so we've talked a lot about sort of what it means for managers to do when, like their staff comes to see them, I've got this situation's playing out, and how to reintegrate somebody who's coming back from a mental illness. I wonder if you could speak to anything that you're seeing or hearing or finding about proactively creating a workplace where wellness can thrive. Any comments about that?
Yes, thankfully, yes. Many of our clients are, some of them are just testing the waters. They're just trying the training and not doing a whole lot else. But we actually, as a company, as a rule, we advise all of our clients that we are one of the tools you need to apply. And so what we stress to them, and we consult with them to help them do this, but they need to make sure that they are top to bottom consistent in the messaging. They need to get buy-in from the C-suite. So if you have a company that is trying to change the culture of something like this, that is so deeply ingrained, it will never succeed if you only train a portion of the company. So we have some clients that are doing wonderful, wonderful work. They're doing the StigmaZero training program. They are also doing, they're having me come in and do virtual workshops to key groups that they want to reinforce the training. And so they're doing that extra. They are also doing mental health first aid, which is parallel to our training, but somewhat different, a little bit more tactical and hands-on. And so that is wonderful. And then the last thing is making sure that your EAP, your employee assistance program, is robust enough to handle all of these things. Often EAP programs are, I would say they're 9 to 10 on 10 when it comes to anything physical, and they range from 4 to 6 on 10 when it comes to anything mental. There are some that are getting better, and companies are identifying that and fixing that. And so when you do all of those things, that's where it gets to be more proactive rather than reactive. It's establishing a culture shift. And that's really what we're trying to help our clients do. And our training is one of the ingredients that they need to make that.
Where do people get the white paper if they want to read it?
StigmaZero.com/white paper.
Oh.
You can get you can download the executive summary or the full academic version, and both are available there for free.
That's where they can get information about you and the training.
Yeah, StigmaZero.com will give you all the information that you need about what we offer, and the white paper you actually have to put in the URL/white paper.
Okay, got it. Last question. I've been asking guests to share a story, if one comes up, about when you were on the receiving end of purposeful empathy. So empathy that was, intentional. Somebody really going out of their way to make you feel felt, right? Anything come to mind?
Yeah, there's several. It's actually hard to choose, but I have been very blessed. So while there is this societal problem of stigma, and I definitely was on the receiving end of it, I do want to clarify and stress that there was enormous amount of support from key people in my life, you included, Anita, and that's what got me through. That's what helped me make it there. And there was one very, very pivotal moment. It was while I was in that dark period of experiencing symptoms but denying my illness, not even fathoming medical attention or medical intervention. I did not want to take medication. And I was in the midst, it was August of 2003, and I was in the midst of a brutal depression. I was unable to work at that point, but I was trying. I was going into work, and it was noticeable. People at work they could tell something was wrong with me. But on this particular Sunday, I spoke to a dear friend of mine who lives in Calgary, and I hadn't spoken with her in 3 months, and it was the first time she'd ever heard me depressed. This was not a video call. This was just on the phone. And in 2 minutes, she could tell just by my voice how sick I was. And she was instantly in full, she recognized that she had to do something. She had to say something to get through to me. And she made this very intentional decision to raise the alarm with me. And she simply said, Jason, I am scared for you right now. I have never heard you sound so low and so depressed. She says, you sound like you're almost not there. And she basically said, I don't care what you think, but you need to see a doctor. You need to get over that, because she knew that I had that stigma. And there was something about the way she did it and the alarm in her voice that got through to me. It really did. It through all the fog of the depression, I looked at the phone and I thought, oh my God, if 2 minutes of my voice can scare her about my wellness to that level, then maybe I need to take it more seriously. Maybe I need to act like something's wrong with me and go do something about it. And the next day, I took the bus down the hill. I lived on this street called Côte-des-Neiges in Montreal, and I was on my way down. It passes the Montreal General Hospital. And instead of going to McGill, I got off the bus. I walked into emergency. I sat down and I said, I need to see a psychiatrist. I'm suffering from severe depression. That was the first time I said that out loud. And it was the first step in me eventually getting my diagnosis, getting the right treatment, and ultimately recovering. So I give Jennifer so much credit for what she did in that moment. And she joked about it. She calls it a mama bear moment. She felt so protective of her friend who she could tell was suffering. And I also think it's a beautiful example of empathy. I felt her care for me through the damn phone. It was awesome. And so yeah, I would like to give her credit for that right now.
Beautiful story, and what a great way to end our conversation. Thanks so much for the time you spent. I'm sure your phone is ringing off the hook, but you're doing great work, Jason. StigmaZero, stigma fighter, Jason Finucan. Thanks so much. Thanks for watching. Thanks for listening. See you at the next episode of Purposeful Empathy.
What if you had access to your own council of coaches to help you break free from your thinking clutter, make that important decision, and liberate you from whatever is holding you back? At Grand Huron International, you get to select the coach of your choice anytime from any place. Visit grandhuroninternational.com to harness the power of on-demand coaching today.